So I noticed a few months ago in pictures that my nose goes that way instead of straight on.
The goal is truly to give a nose that looks like a patient was born with it.
I would like it to go straight. I don't know.
I'm Dr. Richard Reish, board-certified plastic surgeon practicing in Manhattan, and I specialize in rhinoplasty. I graduated medical school 12 years ago and have been performing rhinoplasty since then and have performed thousands of rhinoplasties.
Hi there, my name is Rachel. I am 42 years old and I am considering rhinoplasty. So I got my nose done when I was about 31, 32, and now I'm considering revision rhinoplasty because I just feel I don't like how it came out the first time, and I would love to fix it, but I don't know if it's possible, but I would love to.
Rhinoplasty has really changed dramatically over the past 50 years, over the past 20 years, even over the past 10 years. More so in the 80s and 90s, it was really all about removing tissue from rhinoplasty patients. It was the overdone look, the scooped out nose, the really pinched tip. What a lot of patients were finding, there were a lot of problems with that type of surgery, functional breathing problems, and so we've really gone away from that in modern day rhinoplasty. According to ASPS, rhinoplasty really hit full stride in terms of numbers in the year 2000. This was sort of around the same time where a lot of celebrities were coming out and saying that they had rhinoplasty done, and that's really helped contribute to the prevalence of it in today's era. So today I'm going to take you through all different aspects of rhinoplasty and help you decide if it's worth it for you. Patients have come to me to fix a lot of problems with their nose. There's basically almost no limit to what types of issues you can fix with rhinoplasty, whether it's dorsal hump, drooping tip, bulbous tip, retracted ala, the list goes on and on and on. I've seen patients of all different types of shapes of noses, and everyone has their own individual goals, and that's really the most important aspect of my first consultation, is finding out what every patient wants. The most common issues that patients come to me for in order to fix are reducing a dorsal hump, lifting a drooping tip, deprojecting and overprojecting or long tip, meaning make the nose look smaller in general. I see patients from all over the world coming for revision rhinoplasty. Some have had 7 or 8 different rhinoplasties before they see me in the office. And that's really such an important surgery to do right the first time. And if it's not done right the first time, you have to get it right with a revision surgery.
So in the age of social media, this lovely age we're in, you are constantly taking pictures. And I cringe because all I see is a big old beak sticking out and my hair. I'm just like, oh no, this has gotta, we gotta fix this. I just wanna make the tip smaller. I don't wanna go crazy. I don't wanna look different. I just wanna refine this, that's it.
And the ideal candidate for a rhinoplasty is someone that knows what they want. The definition of an ideal nose can take on any form. That's the best thing about rhinoplasty, is that it's so individualized for patients. And what one patient wants, another patient hates. Most patients want a nose which just fits their face. When a patient doesn't like the way their nose looks, it can cause a lot of insecurities. And that's one of the best things about rhinoplasty surgery, is that we can really fix a lot of those insecurities and restore confidence in patients. So oftentimes when a patient comes in with a celebrity nose that they've picked out, you really have to be careful as a surgeon to guide patients as to what will actually fit their face and what won't fit their face. What may look totally natural and appropriate on one patient's face would look absolutely out of place on another patient's face. And so as a board-certified plastic surgeon, it's my job in an ethical manner to tell patients, yes, we can do this for your face, or no, this is not possible, and these are not goals that are attainable with rhinoplasty surgery. There's 2 main types of surgical rhinoplasty. One is closed and one is open. In closed rhinoplasty, there is no external incision. It generally speaking has less swelling, however, comes with some tremendous drawbacks. In closed rhinoplasty, you don't have the exposure that you have in open rhinoplasty. Furthermore, you can't do a lot of the cartilage grafts that you do in open rhinoplasty. Therefore, closed rhinoplasty can have a higher revision rate than open rhinoplasty. On the other hand, open rhinoplasty involves a small incision at the columellar base of the nose. However, I can tell you, having done thousands of rhinoplasties, I've never once had a patient come in with a noticeable scar after open rhinoplasty. The main advantage to open rhinoplasty is that there's much better exposure. You can do a lot more cartilage grafts, and it's a really, really great way to perform both aesthetic and functional rhinoplasty at the same time. The only drawback to open rhinoplasty is that there is more swelling in the aftercare. Septoplasty is meant for patients who have a deviated septum. A deviated septum can cause breathing problems. So patients who come in with breathing problems or crooked noses from the frontal view will be candidates for septoplasty. Rhinoplasty and septoplasty are frequently and safely done together at the same time, combining into the same surgery. In fact, I think it's best to do a septoplasty at the same time with a rhinoplasty, because in a septoplasty, you're removing septal cartilage. Septal cartilage is the deep cartilage inside the nose. That's truly the best cartilage in order to do cartilage grafts for primary rhinoplasty. Alternatives to rhinoplasty, first and foremost, which should always be considered for every single patient coming into the office, is no surgery. It is perfectly acceptable to tell a patient no, or to not offer a patient surgery, or for a patient not to want rhinoplasty. If someone comes in with a perfect nose or unattainable goals or very unrealistic expectations, perfectly normal to say you're better off with no surgery, and any good surgeon is going to tell a patient that. There are other alternatives to rhinoplasty, one of which is called a non-surgical rhinoplasty, or has been popularly termed a liquid rhinoplasty. That's where a dermal filler, such as Juvederm or Restylane, is injected into the nasal dorsum and nasal tip, and that can be injected by a large number of different providers. It does come with some serious risks and serious potential complications and drawbacks that patients need to be aware of. Non-surgical rhinoplasty, if injected into the wrong site, can cause nasal tip necrosis. I've had patients come into my office losing their entire nasal tip with just an open wound on their nasal dorsum from ill-placed filler. It's really, really life-changing in a horrible way for patients, and they have to undergo numerous reconstructive surgeries to repair this. According to Real Self members throughout the country, on average, their total rhinoplasty cost was $7,500. Here in my practice in Manhattan, the typical cost is $15,000 in total. So the costs of rhinoplasty really vary based on geographic region, but more importantly, surgeon expertise. Now we're going to discuss the pros and cons of rhinoplasty. A lot of the great aspects of rhinoplasty include boosting self-confidence. Because the nose is such a prominent central portion of the face, it can tremendously increase someone's self-confidence and really make them feel more comfortable in their own skin. Recovery from rhinoplasty is not painful. I tell my patients the typical recovery takes about 1 week before you can return to work, go out to dinner, really do whatever you want at a week. You can even go back in the gym at a week. The recovery process from rhinoplasty has to do more with swelling and some bruising under the eyes, but the pain level is not really great at all.
The main question was like how the healing process was going to be. I didn't know, you always see those women with the huge dark eye circles but it only took a week. I had no bruising or anything like that. It took a week, I was back to work.
And now for the cons of rhinoplasty. One of the cons of rhinoplasty is that it can be relatively expensive for a lot of patients. One aspect that a patient should definitely look into if they have a deviated septum is potentially getting insurance to cover a portion of their procedure. Typically, if you have a documented deviated septum and breathing problems, insurance can cover approximately half of this surgery. After surgery, there can certainly be, and is expected to have, a swelling and bruising. This generally lasts up to a week in most patients, but can last 2 weeks in some patients. In my practice, I advise patients that they're able to return to work, school, or go out to dinner within a week of surgery. Some patients can have nausea or sore throat after surgery, but this typically clears up within a few days. The typical final results of rhinoplasty don't show themselves until a full year after surgery. It does take 1 full year for the swelling to completely resolve in most patients, and therefore the results sometimes don't show themselves till after a year.
I don't know if there's just one check the box kind of nose. Like I feel like there's some women that I see that have way bigger noses than me and they're just stunning to me. Like Bella Hadid. Like, oh, just damn, her nose is good. It's kind of like, I guess, what goes with your face.
So now for the important question, is it worth it? 91% of Real Self members who've had rhinoplasty say it is worth it. Of the patients who said it was not worth it, many cited aesthetic problems, collapsed nostrils, breathing problems, asymmetry of their nose. Communication is the most important aspect of obtaining a good rhinoplasty result. Have you had rhinoplasty? Tell us all about it. Make sure you subscribe to Real Self and more videos like this.